Have you ever heard of PCOS but weren't really sure what it means? PCOS or polycystic ovarian syndrome affects 1 in 10 women worldwide, and many don't even know they have it. Today, let's break it down in the simplest way possible. It's Health Wednesdays, where I talk about different health topics and give advice so we can all live healthy lives. So, what is PCOS? PCOS is a hormonal condition that affects how your ovaries work. Normally, every month, your ovaries should release an egg during ovulation, but in PCOS, things don't always go as planned. So instead of a single mature egg being released every month from the ovaries, your ovaries may develop this multiple small follicles that don't fully mature, they don't fully grow, they don't fully ovulate. So this leads to the irregular period or sometimes missed cycles completely. But PCS isn't just about missed periods. It affects different hormones all around the body and leads to different types of symptoms. So what happens when you have PCOS? PCOS can cause an increase in androgen. Now, androgen is a hormone that's usually found higher in men. So for example, testosterone. Now, this hormone causes acne, excessive hair growth, for example, in your face, your chest, your stomach, places that we do not want hair to grow, ladies. Many women with PCOS experience insulin resistance. It means that their body struggles to use sugar properly. So instead of your body to burn sugar to use for energy, it stores it more as fat, especially in the belly region. And sometimes it's even harder for you to get rid of. Many women with PCOS might feel more tired, more anxious. They might have difficulty concentrating and also experience a lot of mood swings. So why does PCOS happen? Scientists don't really know what causes PCOS, but what we do know is genetics and insulin resistance plays a major role in this. So if your mom, your sister, or your grandma has PCOS, there's a high chance that you would as well. And insulin resistance, think of insulin like a key that helps sugar to enter your cell. In PCOS, this lock is jammed. So what happens is your body makes even more insulin to force this door open. But the problem with increasing your insulin level is it basically triggers your ovaries to produce more androgens. Now, androgens is what causes all the symptoms that we've talked about. It's a vicious cycle. So what are some of the complications that could happen if you have PCOS? Since PCOS makes your ovulation irregular, it could mean that it could take longer for you to get pregnant. However, with the right treatment, women with PCOS can conceive successfully. Remember that insulin resistance we talked about? Yeah, over time, it could increase your risk of developing type 2 diabetes, which is why it's so important to manage your sugar levels. Can PCOS be cured? PCOS doesn't have a one-size-fits-all cure, but the good news is it's totally manageable. The key is to understand your body and how it works and work with your body and not against it. So there are a few lifestyle tweaks that can make a big difference. Eating balanced meals. So anything that will just help you stabilize your blood sugar levels to reduce that insulin resistance that we talked about. Move your body, ladies. So staying active, yoga, weightlifting, strength training, anything that can just help to improve your hormonal balance, that would go a long way. Take all the stresses from your life. Like, let's just block out all those stresses. So medical management for PCOS depends on whether you want to get pregnant or you don't want to get pregnant. If you don't want to get pregnant, birth control pills, they are really good at helping you to regulate those ovulations that we talked about and also reducing the androgen levels, those hormones that we talked about. If you are trying to get pregnant, ovulating inducing medications, they can help to stimulate the release of mature eggs. PCOS isn't just about missed periods. It's a full body condition that affects so many women and isn't talked about enough. So whether it's by lifestyle changes, medications, or both, every small step can make a massive difference.